Inhaled insulin is now FDA approved for kids 6 and over with diabetes.
9 News medical expert Dr. Payal Kohli joins us now to talk about this new option for pediatric patients. Dr. Kohli, welcome back. Very important topic. Why is type 1 diabetes so challenging for kids? And can you highlight some of the challenges that they must be facing every day?
I have been waiting my entire career for inhaled insulin to make it into kids. You can imagine, so type 1 diabetes, as you know, is autoimmune diabetes. It's when your immune system attacks your pancreas, kills off all the insulin, and we need insulin every single day. So these kids are tied to a needle for their entire life. They have to check their blood sugars, they have to inject themselves with insulin. There's a long-acting insulin that they use, and then they have to inject it every meal. They have to predict how much they're gonna eat, and then inject themselves 30 minutes before they eat and sort of hope for the best. Now with continuous glucose monitor stickers that tell your sugar all the time, things are a little bit better. Insulin pumps, things are better. But you can imagine being a 9-year-old or being a teenager and being tied to your insulin all day long.
No, I can't imagine that. I don't think I knew it was quite that intensive. So how does this change the game? How does this work? It's like an inhaler, right?
It's an inhaler, Alex, you're absolutely right, and it works on many different ways. So one, the fact that you inhale it means it goes through your lungs, it's in your bloodstream in 1 minute. So we're talking a fast onset of action, so you can actually eat your meal and then take it afterwards as opposed to taking it 20, 30 minutes before. Within 12 minutes, it's starting to lower your blood sugar, and then as soon as you're sort of done with your meal, within an hour, it's gone. So it's a fast offset of action, which means that if your sugar is still high an hour after, which is how our body normally works, you can dose yourself with a second round. So I'm hoping that not only does it take away the needle, it also helps with better blood sugar control, which we know is tied to risk of heart disease and blindness and kidney disease and all these other complications that these young kids might have later in life.
It seems like a win-win. Are there any risks with the inhaled insulin for kids?
So they were very cautious about bringing this into kids. It's been in adults for a long time, but the reason they took so long to bring it into kids is, you can imagine, we're inhaling it through our lungs, right? So if a child has asthma or lung disease, that could trigger something called bronchospasm, shut down the lungs. The dosing is also a little bit tricky here, right? Because it comes in these little cartridges. So it's harder to control the dose as opposed to an injection where you can dial in exactly how much you need. And then of course we have to monitor kids' lung function over time because their lungs are still developing. And you start to put something in there that's absorbing through the lungs into the bloodstream, you have to make sure it's not creating inflammation or scarring in the lungs long term. So they're really going to look at pulmonary function tests, how well your lungs are performing as you start to use this insulin.
This sounds expensive. What are they saying about the cost?
Yeah, so here's the good news. I mean, so if you just looked off the internet, $2,000 a month, which is ridiculous for something that you have to take for the rest of your life. But the good news is the company has now made it much more affordable. So we're talking $99 a month, which is still a lot, but it's not so bad to avoid the needles. Now, it's not going to avoid the needles altogether because, as I said, our body has basal insulin that releases all day long, and then we have mealtime insulin 3 times a day or however many times you're eating.
So it would reduce it.
This would take away the mealtime pokes, right? Because you've got your glucose monitor on, you can just inhale your insulin right then and there. And let's say you're at recess, right? You don't have to go off into the corner and try to inject yourself or fiddle with your pump, which we know can malfunction. You just take a hit of that inhaler and eat your snacks or go to a birthday party or what have you. So I'm really hoping that more parents will talk to their pediatrician or their endocrinologist about if this could be an option for their kids.
Yeah,
sounds like a game changer.
Exactly right. All right, Dr. Kohli, thank you.
Thank you.